Hello, I'm Jeffrey Potter. I'm a chiropractor doctor in the Tomball, Texas area, uh, located in the medical center by the HCA hospital and many other doctors in the general area there, different office buildings. But anyway, the idea is just trying to introduce myself to the community, give you a little video of myself. That way you can feel comfortable to kind of know who you may potentially meet if you're in the area or in needing a chiropractor doctor. Now, keep in mind, with chiropractic, many times we're confused as a patient where to go, or maybe we just know that pain's coming on and you've had a doctor's visit or you haven't, or you're just kind of confused. You just know that pain's happening and you're thinking, well, maybe it's my back and maybe I could just keep the keep it to a simple adjustment, a chiropractic treatment, or some physical therapy you'd heard about a friend in the past. And so you just kind of were just thinking of that. Well, a lot of times chiropractors are kind of involved in different ways of treating. Many there's so much variability. You're like, well, I go to one chiropractor and they do one thing, then I go to another clinic and they do completely something else. And so there's a lot of variation. So each clinic kind of has an objective that they kind of sticking with. They have a business plan and also a clinical objective for their patient. And so a lot of times patients are kind of misplaced. They'll kind of go to one place and then realize they're not being helped too much because of their focus is not with for their needs. And a lot of times clinics, they don't like to run business away. So they'll try to merge that patient into their program, and a lot of times it doesn't work. But meanwhile, the patient's still hurting and needing proper care. Well, so one thing too, many patients, people in general, don't need chiropractic over a lot of times for most of their life until they start to really feel some serious pain coming on, and a lot of times it's due to a car accident. This is a real common way to start looking for chiropractic physical therapy care. Car wrecks, you just be jerked. You have a lot of sprained muscle being over jerked, just like twisting your ankle. It's very concerning, the pain. And then, you think, well, my gosh, this is a lot of money. It's expensive. So you get an attorney and maybe. And so a lot of times attorneys have these relationships with specific clinics in the general area, and they have for years. So these relationships are kind of bonded. And as a patient, you're just going to get sucked into that system, which is okay. Patients can become aware of their injuries. They can literally may need an MRI at some point because they're not getting better with basic therapy. A couple of weeks, typically they'll reevaluate, and MRIs can learn if you're have a torn disc, ligament, and things like that. So, but the objectives can get a little out of control in these clinics. A lot of the management is so business tuned where they're trying to maximize income as far as services that the patient's receiving, and this can many times limit what the patient receives on their damages at the end, and not recover as much financial recourse because so much medical bills have been created. So there's this uneven return when it comes to closure. But these are just basic ideas to kind of ponder when you're thinking about a chiropractor. So if you're not involved in an accident, well, you're still having pain, and it's pretty concerning. So as a chiropractor, I just know giving a little information to the general public help you guys make better decisions. So if you're trying to shop, well, there's many chiropractors that are focused on a lot of exercise, health, and fitness, and almost like a trainer, or maybe an advanced personal trainer. And expensive, very expensive to go. It's almost best to just get a personal trainer, really. But there again, as a patient, you're really just kind of diving in and hoping that you land the right spot. It's almost like throwing a roll of dice. You got so many options, and there's a lot of pitfalls along the way if you just don't choose the right place. So how do you know where to go? Well, you got a friend that's referred you. Well, maybe your friend had a different need and had a different directions. It's very difficult to kind of figure out where you need to be as a patient. Well, that's what I do is I'll typically, as a chiropractor, I like to have a consultation with you in my office at no cost. We take about 10 minutes. We have you fill out some forms, inform you, alert you of some basic information and things, and then you sign the forms, and then we can begin to discuss options and what best suits you before proceeding. And so that this will allow you to get more comfortable with what I do. But as a chiropractor, I really like to take that minute and discuss, is this an option that I might be able to help you best with, or should you move on to other options? So there, that is quality time spent with you at no cost. And then we can start getting down to some nuts and bolts of helping you if that's an option that I might be able to do. I know that many chiropractors are point of entry. They're literally just providing basic care uh, with a different mindset. Uh, but the idea is, okay, so what needs to happen? Well, typically it's consultation, and then we can then learn. So should you get into an exam, where a physical exam is a way for the doctor to learn if there's any tests needed, help make the proper decision before if any treatment would be rendered. You know, you need to decide, is there a way to help you? Well, many times the patient doesn't need much diagnostic testing. A lot of patients are assuming you get an x-ray. Well, it's not mandatory. We can decide if there is a malalignment situation going on that would cause muscles to be tight, pinched nerve syndrome. And this can, a chiropractic treatment can be very helpful and resolve the excruciating pain that can be related to malalignment, or subluxation is a fancy term for malalignment. But the idea is muscle spasm, pinched nerve, or inflammation, or lack of range of motion due to serious pain upon movement. And this headaches involved, typically numbness, tingling, burning sensation, sharp mid back pain or low back pain. It could be radiating component down the arm or hand or even leg or foot. So so it's like, okay, well, do you have to get an MRI? No, you don't. Do you have, so the exam allows us to make these clinical decisions and learn what would be best for you based on what we've learned from school, from our education. We are making educated clinical guesses. We're not just randomly guessing. And so this would be more of a clinical scientific approach, and this can really help the patient find their wellness. Many times, the patient would also need to be seeing their family doc for any medication management or possible um, indications of any diagnostic tests that might rule out kidney flank disorder or bladder disorder that could lead to pelvic or low back pain, and just things like this. So it's like, oh, I don't want to spend so much money as a patient. I hear that chiropractors are so expensive. Well, it's not really smart to even think that way, especially for your body. The best thing to do is think, okay, who should I see? Try to get a referral from a friend or a family member, and this can usually save you from a lot of time, money spent that wasn't necessary. But anyway, thanks for taking a moment, give me a chance to introduce myself and give you a little synopsis, a little summary of what to think about when you're trying to find a chiropractor. And have a nice day. I look forward to you guys visiting me if you feel like you need to consult. I don't charge for that. I'm at 281-216-8306. By text. Typically, I'll ask for an ID or an insurance ID and a date of birth on this text, and then I respond with a disclaimer that is an indication of, hey, this information is subject to HIPAA privacy rules where we cannot share your information, so you're safe with that. Texting a license or an ID. And so what this does, it allows me, you're showing intent, and so that we can trust that conversation that truly you're meant to come in to be a patient. But anyway, have a nice day, and it's nice to that if you guys looked at this video, thank you for that. Bye bye.